Hi Brandy, good morning. Hey Linda. Hey Rennie, how are you? Roro, what's going on? I hope you guys can hear me good. Hey, relax. How is Duke? He's right beside me. There he is. He's all ready to play. Hey, come. Yeah, guys, some of the comments are being blocked. So whoever send me a message, please retype it again. Everybody wants to see Luke. There we go. He's relaxing right now. Oh, there he comes. Hey, say hi. Say hi to everyone. Look up here, look up here. Yeah, there you go. Do you see everybody? You wanna say hi? No? He's too busy. He wants me to make him some food. Usually he likes to eat in the morning. Here. What? What do you need? This is the last piece. There, eat it. Code Master, what is your age? Age is just a number. There's Duke. He's doing good. He's waiting. He wants to go do his little walk today, right? He's up early. He's been up since 4. Pancakes or waffles. Well, you can do pancakes or even waffles, just strictly eggs with no grains. That would be ideal. I think that would be good. Hey, relax. What do you need? What's good? You can actually try niacin for schizophrenia. You can actually take about 3,000 milligrams of niacin. That would actually help quite a bit. but you have to be careful because it will cause some significant amount of flushing. Best medicine for blood pressure, you can download my blood pressure ebook. If you go to my main website, I do have everything explained in specifics. So you can actually download the ebook and I'll actually teach you how you can reverse your blood pressure. Very easily done. So if you just go on my website on the top left corner there, you can actually access it. Hey, sit. Nice, and how much? You gotta take about 1,000 milligrams 3 times a day. Just keep an eye on your uric acid. Empty stomach. Now you are gonna experience some flush effect, which is fine. That's part of the process. Patty, this channel is mostly, we deal with quite a bit of cardiovascular, anything from your head to toes, any type of issues you have, supplementation, we're gonna deal with that. Niacin or NMN, they're two different things. Niacin is different than NMN, even though NMN does have a little bit of it, but it's for different effect. Loved your YouTube video on plaque removal. Do you have any updates on products results? I'm still waiting. I won't be able to see the cardiologist again till February 24th. Once I do that, then waiting for my CCTA scan to be approved. It's just right now, it's just a waiting period. I've you know, for a fact I do test a lot of products, so currently I'm testing 3 different products, and we're seeing which one is gonna actually do its job correctly. I had high blood pressure for years, stopped drinking alcohol, blood pressure normal within 2 months. Perfect. Yeah, alcohol is one of the main causes because it does flush out magnesium and prevents the body from actually producing proper nitric oxide, and that's why we end up having blood pressure issues. But as soon as you get off of it and your body stabilizes, that's a good sign, 100%. It's all related to the diet. You don't need to take anything to actually fix most of these root causes. As long as you fix your lifestyle and you get the sufficient nutrients in the body, everything is fixable. We just have to stay consistent. Right, Duke? Even Duke knows. Is TMG safe for heart patients? Oh, 100% it is safe. And it actually does help with the methylation process, especially if you're going to be taking a lot of niacin, for example. When do you come on live? TikTok doesn't notify. This is my 2nd time coming early morning. I think that would be the ideal time. I think maybe moving forward, I might maybe book like the first 2 hours in the morning and just start doing the live. I'm just testing it between the morning and the evening, see if that timing would work. What is your diet? I follow a carnivore diet for the past 10 years already. Hey Farida, how are you? Good morning. So it varies. I'm gonna try probably to do morning or evening. Would love to do in the evening, but it's tough sometimes when I have to take Duke for walks and stuff. Supplements to boost mitochondria. You got D-ribose, you got creatine, you got NMN. What can I do for my liver to prevent from damaging more? Well, you can actually reduce the fructose, reduce the glucose. You don't need a lot of that stuff, and you can actually help reverse the damage for the liver, especially if you have a non-fatty liver disease. Keep in mind it takes roughly about 3 years to fix or repair. Duke, hey, what can I do for my liver? Hey, we'll go soon. Let me finish. Hey.
Yeah.
go outside. Okay, give me a second. Let me just... tips for CFS syndrome. You know, you can do D-ribose. I like D-ribose the most, and NAC. They work pretty good for that, and they have to take them on actually in an empty stomach for them to work at least twice a day. Let me open the door. Give me a sec. اعطيه شيء ياكله على التليفون انا. Can vitamin D and K2 with coconut oil powder form? Yeah, should be not bad. Vitamin D3, just make sure you're taking about 1000 IU per 25 pound of body weight. What does it mean when a doctor says I have a textured liver? What does he mean by that? I have to see the report. You know, these doctors, they come up with so many different format to confuse the patient, and that's why they never really break it down in specific. Textured liver, you know, liver is, I mean, there's, you know, there's either a fatty liver or not. Are you at 5%, 7%? If they don't really give you an exact number, it's just, it's irrelevant. What are your thoughts on hydroxytyrosol? Oh, this is a polyphenol. What do you want to know about it? What are you getting it from? I don't know if I have access to it here, but it is actually like an antioxidant. It is a very strong polyphenol. It's a lot more powerful than if you're actually comparing it to green tea and stuff. Home trainer, bicycle and treadmill, which one would you recommend for cardio health? I don't know if you can see what I have behind me. This is what I use. I use a Rogue machine. It's a bike, the Echo 3. That's the one I currently use. I go 30 seconds to 3 minutes. And I do that multiple times every other day. A little off topic, just curious, do you feed Duke raw diet meat and vegetables? His coat looks AMA. So this is what I feed Duke. For example, yesterday for dinner he had 1 pound of meat, 1/4 cup of pumpkin, and about 6 ounces of fish, like wild salmon. That's his typical diet. And usually sometimes I would add like 3 eggs. So the meat and the fish are cooked. The meat half cooked, just because if I give it to him 100% raw, he does not really finish the full meat, and he does not really, his stool becomes a little bit more softer. So I cook, you know, at least probably 40% of the meat, but the fish is always cooked. It's never raw. For some reason he doesn't like it, and the eggs has to be cooked. If I give it to him raw, he gets a runny stool. So that's how I kind of keep him in a healthy. I don't give him any kibbles at all. I used to long time ago when it first started, but I don't. Show us the machine again. So this is it, guys. I don't know if you can see it. It's a Rogue machine, Echo Bike 3 by Rogue. That's the one I use. It doesn't require power or anything. But I go 30 seconds, 3 minutes, 30 seconds, 3 minutes. So I do that 30 seconds as fast as possible, hitting about 600 watts, 700 watt. And I do that 30 seconds, about probably 4 to 6 times per session. I just want to know if you take hydroxyl for general health, is it safe? I don't take it. I cannot get it here. I don't know where can you get it from. Let me see if I've heard about it. I've done some research on it. I don't take it, but You could, like, I take a lot of polyphenols, Emma, so that's why I don't really look into some of that stuff. Even thought it does have some good benefits for, let's say, cardiovascular, better than a green tea and stuff. It does have some anti-inflammatory effect and stuff. Maybe I'll talk about it a little bit more in specific. If you can find a good source, then definitely take it. I like to use a lot of polyphenols for I like to use a lot of polyphenols because actually it prevents oxidation of your lipids, for example, and they're very strong antioxidants as well to protect the heart. But yeah, if you can get your hands on it, go for it, Emma. Hey Sahar, how are you? Do you take Rogaine? No, I don't. Can you be deficient in magnesium even if blood test shows perfect levels? Your blood test, it depends where you check in. If you're checking magnesium, that's it by itself. That means they're only checking serum, which is it's irrelevant number. You have to check your RBC magnesium. Can I ask you if GDH is positive, serum deficient, A and B negative? I must do something. I'll have to check on that, Laura. Maybe send me a direct DM. Which polyphenols would you suggest? I take a multi-level of polyphenols. The one I take has about like 6 different polyphenols. I get roughly about 1,700 to about 2,000 milligrams of polyphenols daily. We need that much to actually prevent soft plaque. Currently on Repatha and statin. Numbers never went down on statin, but great since Repatha. Numbers means nothing. G's groove. Numbers mean nothing. It's all about oxidation. That's what actually counts. You can actually get off statins. You can actually wean off of them. And the question is, you need to do like further blood work just to make sure there's no oxidation. Lowering the numbers of cholesterol means nothing, absolutely nothing. Cholesterol is an antioxidant for our bodies. Yeah, the polyphenols I take has about six different kinds from green tea, quercetin, curcumin, pomegranate. So it's a mix. I used to take only pomegranate, 2,000 milligrams. Now I actually take a mix. Geez, I can help you with that. If you want to book a time, we can definitely talk about it. Cholesterol is good for our body. Cholesterol is an antioxidant for our body. The downfall about, when you break down the cholesterol, you have like HDL and LDL. It's all about cycling back to your system. But what happens is sometimes LDL gets oxidized because of free radicals in our system. So it doesn't mean if you actually lower it, you're feeling better. If you lower it, you're causing other harmful things to happen in your body, such as hormonal dysfunction, testosterone not working correctly, vitamin D is low. So there could be many issues. So you definitely don't want to lower cholesterol. Even thought, your brain makes its own cholesterol, it's self-sustained, but still statins will conflict with that. And that's why a lot of people tend to get like foggy brain as well too. So everything is kind of interconnected with each other. You always have the best explanation. Thank you. No worries, Emma. Thanks so much for your support. Which brand of polyphenols? So the brand of polyphenols that when it came to polyphenols, I've always taken, separate in bulk. But recently I came across Bulletproof. They actually have a polyphenol mix. So I'm doing a test on theirs. I'm not affiliated with them or anything. They just have 1,700 milligrams per 4 capsules of polyphenols. So I'm actually testing it right now. And what I look for is quality over quantity, because the quality, that means every polyphenol has to actually be registered, not synthetic, natural. So I always have to look for that. So that's why I like the Bulletproof polyphenol one. I should post it up on my website for you guys to kind of see which one I take. Can I take same time magnesium and pumpkin seed oil and zinc? You should be fine. I'm not sure what you're taking pumpkin seed oil for. Is TMG good for blood pressure? TMG is one of the factor. It doesn't mean TMG helps with the methylation. If you have that methylation issue, then TMG will help. But still, 90% of the time, even if you fix your TMG, if you're still deficient in certain nutrients, you're never really gonna fix a root cause. Are all oils unhealthy? It depends how they're made. I don't like most of them. I don't like any of them. The only ones I like would be olive oil. That's about it. Everything else, I'd rather use animal fats. Why do carnivores stop salting their food after a while, and have you tried it? I would never stop that. That's one of the downfall people have done. I did a test on it where you don't salt your food or anything, and what happened is you start to get fatigued, tired, and you end up throwing off your acidity balance, because you do need salt and you do need sodium to actually create proper pH level in your gut. And if the moment you stop salting or using Himalayan salt or Celtic salt, you're gonna end up feeling fatigued and tired. One person almost 6 years ago came up with a concept where, we don't need salt, we should have it from the food that we consume. Well, we don't get enough, and that's the problem. Which zinc and copper brand do you suggest? I take a local brand. I don't take any copper. I actually drink from copper cups. Newly diagnosed with CKD3 and chronic heart disease, need a stent. Any advice, please? Book a time, Lena. We can talk about it. It depends. If you need a stent, it depends how much blood flow is going through the arteries, whether you have an issue with your LAD or you have an issue with something else. If you're at 80%, usually they'll put a stent. If you're below 80%, there's still possibility of you actually reversing without a stent. Afternoon, Maurice and Duke, and Happy New Year. Same to you, lady. How are you? What if you salt your water instead of your food? Electrolytes, I mean. It's the same thing. Yeah, definitely you can do that. It's I take about 7 grams of salt a day. So definitely 70% one area and 50% on another. Yeah, you still have time. Usually they don't like to stand till you're at least over 80. I wouldn't do a 70% unless it's causing issues. I would actually go, if you end up booking a time, I would put you automatically on nitrate so you can vasodilate the arteries until we fix the root cause. Best supplements for atherosclerosis? There's few supplements for that. The problem is a lot of patients don't understand that when you have a calcified artery, is different than a soft plaque. There's two different things here. We have soft plaque that is dangerous, and we have calcifications. And when the calcification progresses, it narrows the artery, and that's why we end up having heart attacks. Same thing with the soft plaque. If actually it bursts, it causes a heart attack. But when you actually break down a calcified artery contains about 4 different categories. It's not all being oxidized cholesterol. There's calcium phosphate as hydroxyapatite, there's fibrin, there's debris, there's a lot of things. So there's 4 different levels. So in an artery, it doesn't mean if you take one supplement, you're gonna reduce the damage down to 0. In every artery, a calcified artery has 4 different categories. You have oxidized lipids, you have hydroxyapatite, you have fibrin and debris, and most of it, and the last one is like your water and minerals. How to lower cholesterol without statin? Why do you want to lower your cholesterol? It's not about lowering cholesterol, it's about preventing oxidization of cholesterol. That's why you should check when you check your biomarkers, check for OX, LDL, and check for inflammatories like LPP-LA2 and other things. Are there any specific brands you recommend for all these supplements? How do you choose? Quality over quantity, and I usually post a lot of the supplements I take and the ones I recommend on my website. So if you go to the website, you'll see a list of all the supplements that I actually talk about. Statins scared me. Our brains need good cholesterol. So statins, they reduce cholesterol, yes. Now the brain makes its own cholesterol, so statins should not conflict, but there is some type of confliction there. That's why we end up getting foggy brain, and that's why we end up getting feeling fatigue and all that stuff, because we lose the depletion of vitamin D, coenzyme Q10. So it does not directly affect the brain. Indirectly, it does affect the brain. So some kind of chemical causes the malfunction of the brain. There's a lot of hidden information that is not actually shown to the public, and that's the problem. But I would stay away from statins. You can actually reduce your cholesterol with the changes of your lifestyle. And if you are in a hypercholesterolemia level or you're a hyper responder, and that's why, you know, some doctors will recommend Repatha, you don't need that. It's whether your cholesterol, LDL, is being oxidized or not. If it's not being oxidized, why should you even go on that stuff? And you can prevent oxidization. You have astaxanthin, works really well. You have polyphenols. There's a lot of different things. What is your take with MTC protocol on concussion? Yeah, I use a lot of MTC or MCT. What are you talking about? Oh yes, coenzyme Q10 would be a good supplement to take. Yeah, or you can eat beef heart. I rather eat beef heart. Actually tastes better, and you get plenty of coenzyme Q10 from it. My triglycerides are high. Can I use niacin? You could, but you should question yourself. Why is your triglycerides high? Do you think someday we could meet and make hamburger helper together? Sounds good. One day for sure, Tyrone. Do plant sterols help with high LDL? Not really, not for everybody. It depends on your gene. Astaxanthin and polyphenols do the same jobs. They strengthen the heart, yes. Beef what? Beef heart. My friend had 2 dissolvable stents and went carnivore for a year, but still gets chest pain when upset. The chest pain, that's angina pain. So he's actually in deficiency of an amino acid that is causing that. I did a video on YouTube in regards to angina pain, and that's the one he has to look into. And he can follow the protocol. It will actually fix things up. Cheers, Tyrone. Thanks so much. The MTC protocol with C8, I am at 10 tablespoon ATM. 10 tablespoons? That's pretty good. I go roughly about 2 to 4 a day. But you can go, recommendation is about 7. I don't know what's the deal behind it. Why are you taking so many? I'm just curious. Does bergamot help with LDL? Yeah, it takes about 6 to 8 weeks. Prevents oxidization. Keep in mind, like bergamot and niacin and all that stuff that actually supports cholesterol. It doesn't mean it lowers your cholesterol. It supports it based on your body type. How to make sure no oxidization of cholesterol? You stay away from a lot of the seed oils. You stay away from a lot of the processed foods. You stay away, you make sure your gut is not getting fermented with the food. So you don't want the food to sit too long in your gut. My doctor told me to stop taking vitamin D because it showed high in my blood work. Only if you're at 80 nanograms per deciliter or higher. 80 is the optimal level. What is a good amino acid supplement? None. Food. Food is your best amino acid supplement. Beef. Eat 1 pound of beef, that's 100 grams of protein. To keep body in ketosis, to hyperclean the area for 30 days, yeah, you can do that. You can do that. I wouldn't overdo it because you're gonna ruin your thyroid. When and how much D-ribose to take? 2.5 grams, split it at least twice a day. Best supplement is meat, 100%. Food. Grass-fed, grass-finished meat. This is like your best supplement when it comes down to protein. All that whey protein and stuff is all bullshit. The only thing that maybe I would recommend taking could be like some collagen if you don't get enough in your diet, for example. That would be the only thing. I take iodine drops. Yeah, hopefully you're taking about 12.5 milligrams daily. So high triglyceride and cholesterol is okay. It's not whether okay or not. You can reduce it. The problem is, ask yourself, why do you have high triglyceride? Are you consuming too much sugars? Because triglyceride represents your energy. It could be too much sugars or too much fats. You have to kind of fix that based on your diet. So that means you're consuming more than what you're burning. What is the benefits of niacin? Do you recommend the flush? You want the flush for lipids. The non-flush is mostly for metabolism. So it controls your lipids based on your body type. Which collagen supplements you recommend? I use one from Australia. It's bovine, grass-fed, very clean source, type 1 and type 3. I have it on my website. It comes from Australia. It's one of the cleanest form out there. Only meat I eat is primarily beef, fish, and sometimes chicken. Perfect. I don't like chicken much because I can't really get pasture-raised chicken. I only eat beef and fish. Eggs, sometimes imported cheeses. Maurice, do you recommend any specific peptide? Peptide for what? What is your concept behind that? Are you looking to actually inject peptides for specific things. For hernia, yeah, you can do that. Like a TB 500 and maybe BPC 157. Eggs raw in my protein shake. Yeah, the egg yolk, yes, not the egg white, because our body isn't designed to actually digest egg white as good. What would cause loss of fluctuating in afternoon? What do you mean loss of fluctuating? Fluctuating of what? You have to be a little bit specific, Don. Like you're talking about blood pressure, or what are you talking about? Gas, because the food is getting fermented in your gut. Which peptides should women take after cesarean? You can still take TB 500 and BPC 157. I would add GHK copper as well to actually heal the skin faster. The MTC protocol it's mostly for to stay in ketosis to allow the body to actually heal better. Why do I have high stomach acid even 1 year on carnivore? I have to take antacid. No, you don't. If you're not supposed to take antacid, I don't know why you take an antacid. You're actually reducing your stomach acid. Your stomach acid should be between 1.5 and 2.5. I even quit coffee for a month now, I still get high stomach acid. No, you're not getting high stomach acid. You have low stomach acid. You need more hydrochloric, 100%. I would take the antacid and throw it in the garbage. That's actually gonna ruin your gut health. Your pH for the gut should be 1.5, maximum 2.5. So the only reason you feel that you have stomach acid, which is you don't, you're probably in the upper 4 or 5 pH, and that's why you're doing that. So get rid of the antacid and take more hydrochloric acid to actually help with that. Keto neurokinase is more water gut mind to normal value. Where can I learn more about the protocol? Do you have videos on it? I don't. Somebody just mentioned it, but I can create a protocol for you. I tried betaine hydrochloride, but it gave me heartburn. Well, okay, so this is how it works. Emma, so let's say you're eating 1 pound of meat and you take the hydrochloric acid. So let's say you take 2 capsules and you felt a warm feeling as a heartburn. That means 2 capsules is a bit too much. So the next time you consume, you reduce it down to 1. And if 1 is giving you the same thing, that means you don't need hydrochloric acid. That means there's a dysfunction with your salt intake, because what you need is potassium, and I can't remember the other one, to actually be mixed to produce proper, safe hydrochloric acid. But it doesn't mean you have to take antacid. And you have to do it with the food. You can't take it on an empty stomach either. If you take it on an empty stomach, yes, that is going to cause heartburn. I had my thyroid out from cancer. What can I take so cancer don't come back? There's a lot of antiparasitic things such as ivermectin, fenbendazole. There's a lot of things you can definitely do. How to cure itchy skin? Itchy skin is coming from your liver. How do you recommend methylene blue and how many tincture drops? I don't really recommend it, especially if you're a healthy person, because it will actually steal some mitochondrial cells. Zinc plus B complex will combine to help create more acid naturally for digestion. Thanks so much for putting that out there. Cheers. That's what it was, a combination. So you need zinc and cofactors of vitamin Bs. What helps to stop frequency of sleep interruptions? It depends on what you're eating, what you consume, and what you do in the last couple hours before you sleep. Blue lights, phone access, all that stuff. Your system is going into such a high coagulation issue. So there could be a lot of things that is actually interrupting your sleep. How do I cleanse my liver? Well, before you cleanse your liver, there's specific foods you have to stop, like anything with glucose, fructose, that you don't need to be consuming daily. If you are looking for a brand of vitamin B complex, make sure it is methylated form. Do you see the doctor who did autopsy on MS patient brain plaque and it was all parasites? I haven't seen that one. I'll look it up. Parasites happens due to the food we tend to mix. What do you recommend for preventing prostate cancer or cancer in general? You can book a time with me, we can talk about it. And I can give you a protocol to follow with the specific supplementation. at a specific timing. I can't find the bovine collagen on your website. If you go on my website, under supplements, it should say hydrolyzed collagen. It is bovine hydrolyzed collagen from, and make sure you can use the code Maurice20 to get 20% off. Varicose vein solution, book a time with me, we can talk about it. You also try 2 tablespoons of apple cider vinegar before eating, but it gave me heartburn. Do like start with a tablespoon, mix it up with a little bit of water, drink that, then eat. But don't do too. But make sure you're not taking any antacids. Like you have to get off antacids for at least 10 days before actually you feel better. That's how long it takes to actually be flushed out from your system. And 2 tablespoons a bit too high. There you go. So somebody's answering that. That's too much ACV. Like you probably need teaspoon to a tablespoon, not 2 tablespoons. That's quite a bit. What are you talking about? Hello, how are you? On supplement recommendation, how to determine how much can actually be absorbed or eliminated. You would lose anywhere between 40 to 50%, because once you take a supplement, it's gonna go through the harsh environment of your gut before it reaches the small intestine. In that process, you will probably lose anywhere between 40 to 50%. Sometimes you're only absorbing about 20% or 30%. That's why quality over quantity, and whether the capsule is a liposomal style or not. That's why one of the best things to take supplements will always be an enema or IV therapy. And that's the best way to get as much supplementation into your intestine before most of it gets depleted through our harsh environment of our gut. If I don't take antacid for more than 3-4 days, I get really bad heartburn and I want to quit. You have to wean off the antacids. Probably your body's used to it. And maybe in the meantime, you can add DGL and zinc carnosine, so you can actually help your gut to be stable. What do you recommend for back and knee joint pain? Well, it's your diet. Maybe stop all the oxalates first. Thoughts on carnivore diet? I've been on a carnivore diet for 10 years. What would you like to know? I overreact to higher above 1000 IU vitamin D even though I am deficient. What do you mean you overreact? What can I do? I always have side effects from vitamin D. What kind of vitamin D you're taking? And can a carnivore diet produce bubbles in your urine? No, it shouldn't. That's something else, probably check your filtration. Does carnivore diet help heal the thyroid? Possibly. Not necessarily. You can't just say, if I'm gonna go carnivore, I'm gonna heal every issue in my body. Your thyroid, it's 80% your gut. So when you eat carnivore, it's more bioavailable than any other foods. So if 80% is happening in your gut, that's conflicting with your thyroid, of course it's gonna fix it. Only 20% comes from the thyroid. So that's the only reason it's gonna fix it. Benefits of L-theanine is good for your cognitive, mood, focus. It gets rid of that monkey brain. D3, I tried many brands. Have you tried the one with the MCT oil? So if 20-30 is absorbed, how to know how much will actually then get into your system? Excess to, that's why I deal with megadosing, a lot of supplements. And you can tell if you're actually overtaking some. 90% of the supplements will cause a soft stool effect. How can I control high blood pressure without medication? Download my ebook on how to actually reverse high blood pressure. I was taking methylated multivitamin, but after a while I felt prickly. It depends on the methylated forms, which one you're taking. Also, I do not understand how is carnivore good for nitric oxide. Do you know acetylestin? Who's acetylestin? Acetylestin. Carnivore does not actually produce enough nitric oxide at all. It does not produce enough nitric oxide. at all. No matter what, you actually almost as well on a carnivore, because we eat a lot of protein, will actually lower our magnesium, which is um, the essential for producing proper nitric oxide. But either way, we lose the production once we hit over the age of 40. That's a lesson, Prevent Heart Disease cookbook. It's all, there's a lot of bullshit stuff out there. It's not about preventing, and following cooking methods and everything. It's all about nitrate. If you go back in the early 90s, 3 doctors won a Nobel Prize. In the presence of nitric oxide, a person should never have any heart disease or, let's say, a heart attack. Is floating poop bad in the long term? Yes, that means your body's not absorbing the fat. Too much fat, and if so, how can I regulate this? Reduce your fat intake. Obviously, your gallbladder and your lipase from the pancreas is not working correctly. Colostrum thoughts, expensive product for your gut. He is saying low fat vegan for nitric oxide. No, you can't. You gotta keep in mind, the problem is with vegan, and I've read a lot of books about prevent heart disease and a whole bunch of other crap out there, to be honest with you. The problem is with vegan, the oxalates will actually conflict with the nitric oxide production. The sugars from fruits will conflict with the uptake of nitrate. So the only really true veggies that actually increase nitric oxide is arugula. That's like one of your highest. And you have to consume almost 250 grams to get 500 milligrams of nitrate. We need 500 milligrams of nitrate to activate the nitric oxide pathway. It doesn't mean you go vegan. You can still eat meat and you can still add arugula to your diet. It's that simple. Fat is not the cause of heart disease. There's so many people out there and so many doctors and so much, to be honest with you, so much bullshit that people say, eat this or eat that. The best thing is eat whatever, your microbiome feels at their optimal level. And from there, if you have deficiency, because we all have deficiencies, and the only reason we all have deficiencies because our bodies, whatever I consume might be poison for you and vice versa. If I thrive on meat and I'm gonna have a deficiency with my nitric oxide, I can always add nitrate supplement, or I can always add arugula to get proper nitric oxide. And the same thing with anybody being on a vegan diet, and if they are actually deficient in vitamin B12s and essential fatty acid, they can add that to their diet and they'll be fulfilled. So every diet is different based, eat whatever you feel good on. Yeah, I tried keto and carnivore. I have a lot of electrolyte issue, no matter how many I take, heart palpitation and so on, because you're deficient in magnesium. That's the only reason. You haven't fixed that deficiency. 99% of the time, your heart is affected from your gum, from your teeth. Bacteria starts in the teeth. One of the downfall is when we eat, we never really rinse our mouth. We just keep the food till we actually brush our teeth at night. And that's actually, you're causing bacteria overgrowth in your mouth. And that's the biggest issue that we actually, because the teeth are actually interconnected with your heart. What do you think of colostrum? Colostrum is good for the gut, but it's very expensive. Is banana and avocado milkshake good for blood pressure? Not really, no. You're putting a lot of sugar in there. Hey Marie, how are you? I do take bile supplements. Beets are good for nitrate oxide. Right now, they're full of oxalates and full of sugars. Chilajit is bullshit. You just take mineralization. You can get some mineralization. What can I do about cholesterol? Book a time with me, we can talk. Great to hear from you. Good to see you, Ashley Marie. Yesterday morning, brother, love your content. Cheers. How are you? Yes, I tried keto and carnivore. I have lots of electrolytes. The only reason you have electrolyte imbalance, you're missing two main ingredients. You're missing magnesium and you're missing taurine in your diet. Taurine is what actually preserves all your electrolytes. Do you avoid milk and eggs? I eat like probably 10, 12 eggs a day. I don't touch milk because I don't have access to raw milk. Unless maybe one day I'll get my own sheep. Then I'll be drinking milk every day because that's rich in electrolytes. Love your content, thank you. Chilajit makes me feel severely hungover, terrible. I would never recommend Chilajit for anybody, it's just a waste of money. The hype on a lot of this stuff is just crap. Is ashwagandha good for regulating cortisol? Ashwagandha is good, you just have to cycle it, or else it can cause some adrenal fatigue. Can I take potassium nitrate and magnesium together for blood pressure? Oh, 100%, yes. 100% you could. Are you sure it's safe? Yes. What's wrong with 12 eggs? It is safe. What's wrong with that? What, saturated fats? You only get 2 grams of saturated fats per egg. You get 5 grams of protein per egg. You get 168 milligrams of cholesterol. Dietary cholesterol does not conflict with your blood level cholesterol, if that's what you're worried about. Can you recommend a vitamin and mineral deficiency test? Yeah, there is one. I'm trying to actually get a pricing from Genova Laboratories. They actually have one. I highly recommend Maurice. Has helped me so much in my health. Thanks so much, Maurice, for putting that out there. Really appreciate it. Hi from you. When is best to take magnesium glycinate before you sleep? What's cheaper alternative for perfect aminos? Beef. Go buy yourself some good decent meat and throw the perfect aminos in the garbage. All that stuff is garbage. Seriously, you guys wasting money on supplements that doesn't even work. So my doctor said I have a genetic high stomach acid and now I have no idea anymore. Start taking DGL. There's more testing. We can do testing on that, but I think what the doctor is saying is incorrect. There's no such thing as too much acidity in the gut. Have you checked your acidity, your gut acidity? It should be between 1.5 and 2.5. The doctor cannot just say stupid things like that. Seriously, they can't. They can say, hey, you have too much acidity, you're born with it. Acid reflux, what diet is perfect? You can download my ebook on acid reflux. What are the best vitamins to take overall so you won't have to take so many? Depends on your diet. Hey Ziggy, how are you? Good morning. Can you recommend a vitamin and mineral? So I missed, when is best time to take magnesium and glycinate? Before you sleep. What about berberine? What about berberine? Take DGL, he has helped me so much. Thank you, Maurice. Cheers, Marie. Thanks so much for that. Magnesium and glycinate helped me so much. 100% helps you for relaxation, which is excellent, especially for sleeping. It does help. We are all deficient in magnesium, guys. That's why I constantly drink magnesium all day long. Berberine does help with insulin sensitivity, and that's why the only reason people lose weight, let's say, or they drop their HbA1c, but you still have to fix your diet. You can't just rely on a magic pill. Is magnesium malate good, Maurice? Magnesium malate is mostly for energy. Yeah, it's not bad. Okay, I'll try your advice. I definitely don't trust my doctor, though. Thanks so much. How do you know when magnesium supplement is sufficient? What test are you measuring? RBC magnesium, not serum. Do you see they lowered optimal levels of non-HDL cholesterol? Oh, they're gonna keep playing with that. they want more control. Why does berberine make me feel more energetic? Because you're becoming more sensitive. You're actually absorbing sugar or glucose better, so it's gonna give you a little bit more energy. And a suggestion for my 16-year-old, she can't concentrate on her studies. Give her L-theanine. Is magnesium help to reduce blood pressure? Download my ebook on blood pressure, guys. Were you vegan before? I was, yes. I judge by how I feel, and that's it. 100%. Cheers to that. I tried adding berberine back to my life, but it was a no this time. Oh, that's not good. It's probably caused some stomach issues, because keep in mind it does reduce one of the microbiome in our gut. What is it called? Biffy something. Can't remember the name. I never take more than 7 days in a row. Is metformin a good medication? It's okay, but all you're doing is just going after the symptom. You're not fixing your root cause. Do you ever eat bread? I haven't. Sometimes on my cheat day, I want to try some sourdough. So I'm waiting until somebody gives me like a recipe for sourdough. Maybe I'll try it. I don't know. I don't know if I should. What food can neutralize acid reflux? Food combining. Download my ebook. Is Glimpride a good med? I haven't heard of that. I'll have to check to see what it does exactly. was my experience. It gave me a heart attack after being on it for 9 years because I was deficient. Because you are constantly eating. Well, actually, almost every person that goes vegan, I'm not saying for everybody, but for most, we actually graze all day long. And us as a human, we're not meant to graze all day long. Yes, sourdough is the best. I'll have to try some. I haven't had some for probably almost 14 years. Yeah, about 14, 15 years, I think it's been. Because since I've been carnivore, sourdough is better than other breads. It does have a lot less anti-nutrient effect. Whey protein makes my muscle aching go away and feels good, but it makes me breaks out. I never use whey protein. I never recommend it. Can I eat celery instead of juice in it for lowering blood pressure? You could. You gotta eat 3 stalks every time, and they'll give you about a 6 hour. 9 years vegan and heart attack. Was your vegan diet dirty? No, it wasn't dirty. It was very clean, actually, very clean. But I was consuming so much to actually maintain my shape and everything, and I kept putting on weight. And I was never satisfied. I was constantly hungry, hungry, hungry the whole time. So I was like, eat everything, everything that I can find, from fruits to carrots to apples to a lot of vegetables, a lot of grains, but I was never satisfied. What's the best type of protein powder if you need to take one for convenience sake? I would take collagen. I would never touch protein. I'd rather fast and not eat any protein. I would only take collagen. Cheers, Rebecca. Thank you. Love this. I agree. Doing OMAD and feeling amazing. That's awesome. Keep going. How's Canada with influenza A and norovirus? Is a show here in Massachusetts? Nothing. I don't know. I go out every day. Me and Duke, we walk. We go to Cabela's. We check out some hunting stuff, equipment, and everything. And Duke got a chance to sniff. We don't get sick as much. Well, I haven't been sick for a long time. I take a lot of NAC, so, but there's a lot of people who are scared about the influenza and all that bullshit. It's just another flu season. I didn't get sick thanks to the protocol followed by everyone around. Just keep your immunity strong with NAC. You'll be fine, Ziggy. I did remove some plaque in my protocol, and now I'm waiting for another CCTA scan so I can actually see, because I still had 2 arteries. One is at 60 and one about 40, and I want to see if I actually was able to reverse that. So I'm waiting for my CCTA scan. I don't have heart disease. So when they say you have heart disease, that means you have clotting and plaque and calcifications across your whole body, not just your heart. So my whole body is pretty clean, like nothing in my legs, nothing in my body, nothing in my kidneys, nothing in all these places. So the only part I have is mostly my heart. So obviously, whatever have I been doing for the past 10 years, it's actually been working. The only thing is I want to get a CCTA scan, because now they got a scan done. They got it here in the city. It's very, very expensive. I've been saving for it, so I'm hoping I can get that before I go off grid, like soon possible, just so I can check the 2 arteries. What kind of scan is that? Ultrasound? It's called CCTA scan. They actually scan for soft and calcification. Taking calcium supplements destroys my immune system, but I had to take it for oxalate poisoning. No, you don't have to take it. You just have to take borax for oxalates and magnesium. What is maca powder good for? Testosterone, but it takes about 8 to 12 weeks before it kicks in correctly. I take my NAC also. What a difference. Oh, 100%, 100%. When you go out hiking with Duke, do you carry a rifle? Sometimes I do. When I go hiking and off grid, sometimes I do, yes. Most of the time I have bear spray, coyote spray, and sometimes I would take my small 22 rifle. It's a small one. I don't take the big one with me. Thoughts on statins and baby aspirin? I see some strong evidence for it. Statins, all it does is just takes your soft plaque and calcifies it. There's no real evidence behind that it actually saves a heart attack or prevents. I actually got oxalate poisoning for 2 weeks after eating pistachio 1 year after Carnivore. Cheers to pistachio. Yeah, they're very loaded with oxalates. It's crazy. How's Duke? We miss him. He was just here. He just went downstairs sitting with my mom having coffee. He's waiting for me to finish so we can go for a little walk. uh, I know the 22 is only gonna piss the bear off, but I don't wanna hold anything big when I'm walking. To be honest with you, so I rather have the bear spray with me, and I have Duke. I'm not really worried. If there's something coming around, Duke will actually will be very alert. He's my big weapon. Well, pistachio are good. They are very carby, and they do kind of have a lot of oxalates. Maurice, we don't get notified of your lives. I should maybe from now on when I'm gonna go live, I'll probably send an email. I'm not sure. I've been seeing that lots lately that nobody's getting any notifications of my lives anymore. So it's a CT scan. I just looked it up. Do you do a bath after you detox radiation? I do take heavy taurine because taurine is a heavy detoxifier. So there's a CT scan that's actually scans for calcium, but there's one. Make sure if you're gonna check it, Ziggy says what is it? CCTA. So that one they do like more computographic 3D, but still, yeah, they give you a freaking dye and it stays in your body for 72 hours. So you just make sure you do a lot of taurine. If you can handle probably shark oil would be good, or zeolite as well would be excellent. What state you at? I'm in Canada, I'm not in the USA. Is taurine good for mental health too? Yeah, taurine is good for longevity as well too. I take about 9,000 milligrams, and I give Duke about 3,000 to 6,000 milligrams a day. Keep in mind, because with Duke as well too, he tends to actually, they pick things off the ground. I just want to make sure their body is kind of being detoxified, but at the same time, it's really good for your heart, for your eyes, and your brain. So we are all deficient in taurine. We don't get enough of it from food, and if you have, it does conflict with other amino acid, so it doesn't do the job correctly unless you take it by itself. Best diet to lose weight? Carnivore diet. Maybe eliminate all the sugars from your diet. That would be the best thing to do. Yeah, almost any diet, but if you do need a kick in the beginning, sometimes carnivore will help because you're not actually eating any sugars or anything as junk. You can do that for 30 days, and after that, stick to something and stay consistent. Duke is downstairs having coffee with my mom. Best thing for longevity is caloric restriction. Rats live longer. Yeah, it's almost like as a human, if you want to overeat, indulge, but fast and feast, right? So you're fasting for numerous hours, or you're fasting for a couple of days and you're feasting. It's fine with that. How to treat swollen ankles due to prolonged sitting? Do some squats. That means your calves are not pumping the blood back up again to your upper body. That could cause actually heart issues. What do you think of honey? Like real good honey from the mountains? Oh, 100%, especially pastured raw honey. Still, has everything in it. I take that once in a while. There's one company I used to deal with from the USA. They used to send me some, and it actually had like bees, legs and fins and stuff like that in them. Duke, you drink coffee? I wonder, can angina be caused by low stomach acid? It's a deficiency of certain things, a few things with angina. It's mostly L-carnitine and coenzyme Q10 deficiency. I think it was called real raw honey. I think that's the one that I'd consume. Yeah, it's called real raw honey. It's very expensive. I used to get it for like $20. Now it's like almost our Canadian dollar sucks ass, to be honest with you. Now it's like almost $35 a pound. Very, very expensive. Yes, but you can feast on 5,000 calories too. Yeah, there's nothing wrong with that. I would eat 5,000 calories in one sitting, and I would actually fast for 36 hours. As long as you know what your fast limit is, what your intake is, and whether you're actually utilizing it for energy or it's being stored. So whenever I do for almost a year and a half straight, I would eat one meal, fast 3 days. One meal, fast 3 days. I did this for almost close to 9 to 12 months straight. And it's doable. It's doable. And not one meal I would eat 5,000 calories, mostly just protein and high fats. There's good company for honey, healthy traditions, Chilean honey. Most of the time I don't understand what you say, but watching is amusing. Am I going with too much details? It's doable, but I feel like when I fasted for that long, that's when my gallbladder attack started. You don't want to do it that long, especially if you're gonna end up kind of throwing your hormones out of balance and other things. So there's no point. We live in a modern, society right now where we're meant to eat at least 1 or 2 meals a day. Don't do like the extreme what people have done, 100 years ago. I've done it. I've done multiple different type of fasting, and what worked for me, right now is either 1 meal a day, and sometimes I go 2 meals a day, and that has worked the best. So you gotta find the optimal level for yourself and kind of stick to it. Hi Maurice, can you recommend labs to get OX LDL done? Dynacare lost my test and I can't get any. There's none in Canada. Nobody in Canada wants to do it. I tried. So the only place we can do it is the USA. So I tried to kind of sneak it in to one of my labs last week and see if they can send it to the USA. I got a message that no, we're not gonna send this to the USA. So I can't find one in Canada to get it done, unfortunately. I'd love to go to the US, closest border for me is Montana. I have to drive like about 7 hours, 6 or 7 hours. It's called OXLDL. So there's about 8 different testing that they're not found here in Canada, which just kind of sucks. And these 8 tests will actually give you a better prediction of your arteries and everything. And they don't do any of them here. So I have to go to the USA to actually see if I can get them. I would love to actually, I think closest place is Montana for me, but it's about a 6.5, I think, hours drive. I'll have to drive because I can't fly, because I have to take Duke with me. And the thing is, Duke is not vaccinated at all. So they won't allow me sometimes to pass the border unless I find like a friendly vet to do it for me. You don't always need labs, just pay attention to how you feel in relation to what you're consuming. Yes and no. Yes and no. Keep that in mind, watermelons. Yes and no to a lot of things. Sometimes, we do need, specifically if you already had some type of disease or some types of issue that previously we had, then definitely sometimes we want to keep an eye. Oops. Sometimes we want to keep an eye on certain biomarkers because every person's react differently and every person has different reaction, whether you're a hyper responder or not. But yes, after you do the test numerous times, then you know exactly based on your food intake, this is what happens, and based on other food intake, that's what could happen. Then you can actually configure it after. But you're right, in time, yes. I'm so good at Photoshop. Oh, perfect. But how I gotta look at like a vaccination, a vet vaccination for German. I should look into that. I'll send you one. Maybe we can get one done. I got your PDF on high blood pressure, got blood work and salt test. Aldosterone stays too high. Aldosterone, so salt is good. Did you check your RBC magnesium as well too? If you checked your RBC, what was it? Is it above 6 milligrams per deciliter? Now, if you want to fix the aldosterone, how high is it? If it's too high, you can fix that usually with magnesium, omega-3s, and hawthorn. Hi Maurice, can you recommend labs? Okay. What is the pushback from these doctors when it comes to these tests? Makes you think they want or not address the root? Well, they don't. The thing is, there's 15,000 blood tests we can access. The problem is a lot of the doctors, they don't want you to know a lot of these things because they're not educated on them. And I had one cardiologist said, so what if even if you know you have high levels of OX, LDL, for example, and high level of homocysteine, what are you gonna do about it? You can't fix it. The only reason they say that because they don't look at food and they don't look at supplement as a way to fix. And I've showed them proof many times that homocysteine we can fix it, OX LDL we can fix it, LPPLA2 we can fix it, LP small a even if it's genetic is fixable. So a lot of these things are fixable with the food we eat and a supplementation, but they still don't believe that because they want to sell you medications and there's no medications for that. But plus, you tell the doctor, hey, we're not medically deficient, we're nutrient deficient. Once you fix a nutrient deficiency, these are actually fixed. I told my doctor exactly what the tests are called. Yes, my doctor said the same. That makes no difference. But a lot of these things are fixable. If glucose and insulin is okay, do you think consuming potatoes in the evening, sweet or regular, for heart health, LDL particles, or any other cardiovascular markers? I would actually stick with sweet potatoes more than the regular potatoes because due to the anti-nutrient effect. For LDL particles, you can control that with, if you're worried about LDL particles, one of the best vitamin out there is astaxanthin or polyphenols. Which vitamin D is best without fillers? Look for vitamin D that actually comes from cod liver oil. That would be your best, or something that is mixed with MCT oil. I have one I use in MCT oil. You get about 50,000 IU per capsule. Sweet is good. I eat them. Yeah, 50,000 IU. I take one every 3-4 days of 50,000 IU. We do need it. We do need that much vitamin D. We don't get enough. We don't get nearly enough vitamin D. And we need to be at least 80 nanograms per deciliter for optimal levels. If you're not that high, then you are deficient. Any suggestion for acne? It's hormonal issue that acne is high. Okay guys, I'll stay another like 5 minutes or so. I take 50,000 IU vitamin D with 500 milligrams K2, MK7, and 40 drops of acid trace minerals. Hey, where did you get that recipe from? That's my recipe, Emma. Well, of course, from you, Lo. Been taking those for a year now. Any suggestion for anemia? So you can take iron bisglycinate with vitamin C. You can cook a nice steak on a skillet with vitamin C, so you can increase the iron absorption. But you should be drinking water in a copper cup as well too. So it's all kind of related. I finally got some of the nitric oxide from Berkeley and I love it. Thank you for sharing, Hannah. That's good. That's excellent to hear. The retinol question, did I miss something? Are you talking about the retinol vitamin A of 10,000 IU? Maybe it's something I missed. I'm not sure. How is not recommended for pregnant women, treatment skin lotion, synthetic vitamin A. What test can I take for essential hypertension? You can download my ebook on blood pressure, and it'll actually give you a guide of all the biomarkers you need to get. Would be great to do a live or Zoom call with members about success and protocols and progresses. I am gonna start doing one with members. Anybody who's actually connected to Substack. I'm gonna start doing like a monthly 2 hours of one-on-one with everybody. Like it'll be like a Zoom call where we can kind of go back through like a Q&A and stuff. I already have about 30 some members within Substack and as well from YouTube. And definitely, if we can do that, I'm gonna set that up. I'm trying to set one up. It's gonna be probably like a Saturday morning. I don't know if that. I'm trying to actually. I don't want to just set one up and only like 10% of the people would come, because I have members on YouTube and I have paid members on YouTube and paid members on Substack. So I want to see what is the best time frame so we can have like a full video call, but nothing typing. It's all gonna be like live Q&A, and we can kind of chat back and forth with everybody. I want to do that, but I'm trying to find the best timing. So I'm gonna probably send an email to a lot of the specific members and see what works, like Saturday morning, Saturday afternoon, and this way, moving forward, we can actually have that time set. I am gonna send a date option, but the problem is when I send a date option, I need to book that time like a week prior. So this way it actually works for everybody, and I don't end up getting any consultation that same time. Is it okay to consume 2 capsules of Berkeley nitric oxide in the morning and then 2 in the evening? Yes, 100% you could. I do that. Duke is just sitting downstairs with my mom having coffee. Not him drinking coffee. She's drinking coffee and he's sitting with her. So yeah, what I'll do is I'll send an email, and for everybody that is based on the on that program, and we'll actually do it. Have mom join a live sometimes. I should do that. I did that, I think, once when I was off grid. We were having coffee outside. What's your view on health and such? What's her view on health and such? I give her probably about 8 different supplementation. It's very tough to get the family to listen. It is the toughest, but my mom does, my older brother does, my other brother does. My dad, not so much. He's in his late, he's almost gonna be in his 90s. He doesn't really listen. I only put him stuff in the coffee and the water, so I trick him. So I kind of give him a little bit of ashwagandha, a little bit of tyrosine, a little bit of L-theanine. I mix it with his coffee without him knowing, because he doesn't believe in any of that stuff, because he's been raised on a pharmaceutical stuff, right? So I try to kind of squeeze stuff within his food and stuff. That's the only way I can get it through, and he feels great. And some days, because I squeeze MCT oil in his coffee sometimes and other things, because it's good for mentally and all that. But when I'm not around here, when I'm off grid, it's different. Nobody does that for them. I got my mom and dad and younger brother to listen to me, but my older brother doesn't listen. It's very tough to get everybody. No matter how much you do, they still kind of turn around and my parents, they love bread. They'll have to go through at least a dozen a day, because they're used to it. They have that Middle Eastern mentality. They have to eat bread with everything, and they wake up the next day, they don't feel good, or stomach is bloated. And I tell them, it's the food that we eat is actually, that's the outcome of it. And it's very tough to change them when they've been doing it for 70, 80 years, right? For a very long time. Same, so much. It's crazy. Like, and sometimes you tell them, well, eat more meat or eat a little bit more fat or do this, and they question it. They question it. It's like, no, it's not good for your cholesterol. No, I'm not gonna have liver. I'm not gonna have this. So it's. Is it ethical giving them something without their consent? Well, we can't really say that. Keep in mind, a lot of these supplementation, they're actually found in our food groups. The problem is we don't get enough of it. And once a person eating processed, a lot of these nutrients are depleted. So if you're actually putting, L-theanine or L-tyrosine in the food, that's an amino acid that is actually found in that food. But because due to our freaking government and due to our processing and due to the economy we live in, all these nutrients have been depleted. So if you're just adding it and they're feeling good, that means you're actually doing something good for them. It's not without their consent, whether it's ethical or not. It's not like you're freaking poisoning them. You're looking after their health. And trust me, the government and a lot of corporations, are they really looking after your health? Do you ever wonder why we have so much parasites, so much diseases, so many different things are happening to our health? And who do you blame? They're doing it. Are they doing it for good cause or no? Like, come on, 10 years ago, they were going to put statins in our drinking water. The same way they put fluoride, and the same way they put so much crap in our bodies. And yet, we don't question it. Why don't we question it? Do we look at the freaking doctors as gods? Give me a freaking break. He's just another human being, but they're after the bank. They're after money more than anything. High polyphenols, bad for kidneys, high moderate oxalates. Polyphenols won't actually cause any oxalates at all because they're actually extracted correctly. Can I come and live with you guys? Yalla, why not? You got that right. I agree, Maurice. Thank you. I used to give my mother vitamins too when she didn't want them. She used to feel better and tell me, see, I don't need all that stuff you're talking about. No, it's crazy. It's crazy the way it is. And you want to make sure they're feeling good and they're feeling optimal and they're feeling amazing. Like, definitely you want your parents to live a long, healthy life. We don't want the parents to actually feeling, you hit the 70 years old, suddenly you can't do much and you have to take care of them for the next 10, 15 years. You're looking after their health, so therefore they can live, have a nice longevity and be able to see grandkids and enjoy life. You sure can spike my intake. The elderly become our kids eventually. Oh, 100%. 100%. They raised us all that time. The least we can do is look after them correctly. We all had or have the bread thing. Oh, come on, it's true. I used to eat bread like crazy, like non-stop. Can acid reflux trigger high blood pressure? Oh yeah, 100%, because you're becoming deficient in many nutrients. What is extracted correctly? Making the polyphenols, oxalates are removed. They are removed, yes. What's good for parasites? There's a lot of antibacterial supplements you can take. MCT is one of them. Coconut is one of them. My daughter lives in Beirut, Lebanon, and she eats a lot of bread. It's a tradition there. They never stop. They have bread with everything, sweets, high levels. It's crazy. What's your polyphenol source? I'm taking the one right now by Bulletproof. It has about 1700 milligrams. Switch to sourdough bread. Sourdough is probably about 50% better. I'd like to try some. Everybody talks about it. I haven't had any. I think there is no glyphosate in Lebanese bread. Oh yeah, there is. There is. The only place that have glyphosate right now is in Europe, in Italy, in France. But eventually, give them about 10 years, they're going to end up having such a high amount as well too. I lost 80 pounds of lean muscle when dealing with doctor in New York, type 1 diabetic. Type 1 diabetic is still very tough. The only way we can control it is with peptides, with flour from Italy. And that's what we need. So you got Italy, a lot of European countries and France and Italy and Spain. A lot of them, they still use good quality flour. There's no glyphosate or nothing. Right now, I'm connected with a lady locally that she's actually importing flour from Italy, and they stone break them. So my brother is getting some because he still eats bread, him and his wife, and he's gonna try it and let me know. Be careful with sourdough. You may get hooked. may get hooked. No, I'll never get hooked. I like my steak. I like my fish. I like my eggs. And I like my cottage cheese. I can take the cottage cheese and make it into like a bread with some eggs, and I'll be set. And I'll pretend that's my sourdough. I tried it yesterday, it didn't work. I don't know. I think there's a lot of things people are doing. It just does not work on TikTok. Is beetroot good for circulation? Only if you take 300 grams, but the problem is high in oxalates and high in sugar. It defeats the uptake. What brand of flour from Italy? What is glyphosate? What our thoughts on 95% dark chocolate? Yay or nay? Dark chocolate is good, but keep in mind it's very high in oxalates and has nothing to do with, it's just the polyphenol in it, or the antioxidant. It's actually, it's a flavonoid. It's a very small amount of it. Put cottage cheese on sourdough bread, you will like it. Hey, then when I make some sourdough, I will actually have it live and I'll tell you what I think of it. I use fermented beet powder, no sugar. Yeah, but you still have to use 300 grams because the problem is with beets, there's actually a copyright and a patent design on beets. Beets actually work for nitric oxide only if they actually have a patent design of 25%. If they don't mention 25% extracted, that means you have to consume 300 grams to activate your nitric oxide pathway. And to activate your nitric oxide pathway, you need 500 milligrams of nitrate. So 500 milligrams of nitrate, it's found in 300 grams of beet powder. So imagine they sell you like 300 or 500 grams of beet powder for like 40 bucks. That means that's like a day and a half worth of usage. So that's where the issue is. It has to be extracted correctly. All right, guys, I'm gonna get going because I have to do a couple more videos for you guys for TikTok and YouTube. I'll post it around 11 a.m. and we'll go from there. What other supplements increase nitric oxide pathway? There's only 2 out there right now. I have them both on my website, actually. I found with corn flour is better health-wise, it costs more. Corn is man-made, stay away from that crap, seriously. Corn is man-made, stay away from it. If anything, it's gonna cause a lot of health issues. Thanks, Maurice, for all your help. Want to take balance hormones and premenopause. Guys, I do have to get going. You guys have an amazing day. Same to you, Ziggy and Emma. Sarah, you guys, Sahar, you guys take care. Ami, Andre, you guys take care, and we'll definitely touch base. I'll try to come back maybe again tomorrow. I'm starting to like doing it in the morning maybe. It might be a little bit easier, but we'll see how the time goes. In the meantime, you guys take care and we'll touch base.